Welcome to the THOR Table of Knowledge podcast, where we dive deep into the groundbreaking world of trauma care, hemostasis, and oxygenation research. A special thank you to our sponsor, Velico, for their support. Velico is revolutionizing trauma care with their innovative frontline ODP spray-dried plasma system, with the goal of empowering blood centers worldwide to produce dried plasma for transfusions.
So we're here today speaking with Dr. Jeremy Cannon. Jeremy is a professor of surgery at the University of Pennsylvania, and we're going to be speaking about mass casualty events and large-scale combat operations, and are we ready? So Jeremy, tell me your thoughts on our ability to be prepared for large massive casualty events in civilian areas. Are we prepared to take care of large numbers of severely bleeding patients?
Well, Phil, thanks very much for this opportunity. It's great to be here with you at the Table of Knowledge. It's a great question, and it's one that you had really pointed me to several years ago. We had a collaborative project that we did with THOR and AABB, where we sent out a survey to the blood centers, the hospitals in 6 major U.S. cities to ask that exact question. And it turns out that we're probably okay for a moderate scale event for red cells and plasma, but we don't have much surge capacity in those areas. And we're going to quickly outstrip our need for both platelets and cryoprecipitate. So ultimately, we found that we don't have much margin for error. And if the event is even a moderate or, God forbid, a large scale event, we're going to be really lost with inadequate blood supplies.
Right, agreed. And I guess what would you say are potential answers to address those gaps in availability of mainly platelet products when it comes to civilian large-scale massive casualty events?
That's really a tough challenge. We see every day in our trauma centers that our blood suppliers struggle to keep up even with our day-to-day demand. So I think we need to really be creative in tapping into our supply, to identifying additional new donors that aren't currently donating, to give it a full court press in terms of public health messaging. But it starts with the day-to-day work, and then that will allow us to build up a repository of goodwill and donors that can donate on short notice.
Right, completely agree. Improving the donor rate when it comes to platelets, which are mainly apheresis collections in the States, is one way to address the problem. What about the current technology with dried or frozen platelets? Could they also be used to improve our supply?
It's really an interesting question and a great concept. If you think about the shelf life of these products, that's often the rate limiting step of maintaining an adequate inventory for unforeseen events. So if the shelf life can be extended beyond the 5 days that we currently have for platelets, I think that's a real win. So not just dried or freeze-dried or spray-dried products, but even chilled platelets, as you've pointed to, those have a longer shelf life than our current room temperature platelets. So lots of different options, but yeah, I think finding products that have a longer shelf life is definitely part of the answer.
And there's also now the synthetic hemostatic products that act like platelets that also could be used in the future as an adjunct to improve hemostasis, stop the bleeding, so we need less overall components. But you've mentioned components in the study that we published together. But instead of using components, could whole blood be used as a way to reduce the need for total blood utilization?
Since we published that study, the use of whole blood has gone up really exponentially, and I think for the better. And I think of whole blood as being the best incubator for platelets that you could possibly imagine. So absolutely, thinking of ways to call in a large number of donors in the setting of a mass casualty event is very important. Maintaining an inventory of whole blood is a great way to keep platelets on hand.
Right, interesting. So now let's pivot to military needs and the concern for large-scale combat operations in the next 2 to 3 years. Is the military ready for a potential conflict with Russia and/or China?
Our Armed Services Blood Program does amazing work. And I think it's vitally important that we continue to support and sustain that organization. Its collaboration with THOR is really invaluable. Are we ready right this second? I think probably not, if I had to guess, but we've learned so much from Iraq and Afghanistan, how to set up a walking blood bank on short notice, how to safely collect blood products and then test those blood products, and then what you need to do on the back end after you've administered those blood products. All that knowledge is out there, but we have to always guard against losing that knowledge, those lessons learned, and continue to train the next generation of transfusion specialists on how this is done.
Agreed. Very good points. Another concern that the community has is the ability to surge when it comes to the supplies needed or the consumables for blood products. Are you concerned that we're not going to have the blood bags and the tubing, even if we could get the donors? Or basically what I'm asking is, what is the volume of blood that you think will be needed? And do we have not only the donors, but also the consumables to meet that need?
Based on the comments from last night's opening session with General Friedrichs, logistics are a vulnerability, and supplies are part of this. I think you're very wise to focus on that, and I think it's important that we partner with logisticians to make sure that we have those disposables, that inventory ready to go. You're only as good as your weakest link, and I fear that, as you're indicating, that the supplies could be that weak link.
And it's interesting, it's at times we don't learn even from very recent medical scenarios and situations. In the pandemic with COVID, we learned that if you're reliant on other countries for supplies, you're highly vulnerable. But it seems like we're in the same situation with consumables for blood products. Right now, we rely on China and India for blood bags and tubing. There's the concept being discussed within DHA that will develop a consortium from countries to supply the consumables for blood products. Is that a wise choice, or should the U.S. be self-sufficient in being able to produce its own consumables for blood products?
I always get nervous about relying on allies who could turn out to be fickle. I think we would be foolish to rely solely on a consortium of allies. I think it has to be a both-and kind of approach. So I firmly believe we should have some capability here in the United States and should be able to meet those demands on our own.
Right. I agree wholeheartedly. We do need to rely on our friends at times, but if you can be predominantly self-sufficient, clearly the way to go. Any final thoughts or comments you want to make on mass casualty events, preparedness, and or large-scale combat operations?
This is certainly something that keeps me up at night, especially as we think about large global marquee sporting events coming to our country, such as the Olympics, such as the FIFA World Cup. These are soft targets that nefarious actors could take advantage of. And in the blood banking, transfusion, trauma, and emergency medicine, critical care communities, we would be wise to think creatively about combining lessons learned from the military with disaster planning. One thing that I have not really heard about in the civilian setting is a capability the Navy has had for many years, and that is to deep freeze basically red blood cells. So you have this great repository of the ultimate shelf life product. It's good for about 10 years. We know that after big events, there's a huge bolus of goodwill to donate, and many of those products end up being unable to be used. They're wasted. If we could figure out a way to take that bolus and deglycerylize and deep freeze the red cells, I think that would be a great solution to a lasting conundrum.
Sure, it's definitely another source of a blood product that would be needed, although you would still need plasma platelets with it, but at least it could be helpful to a degree.
That was a great example of the sort of the synergy between military and civilian experiences and best practice.
Right. And your comments about mass casualty preparedness also made me think we're not doing enough training. We're not doing enough exercises in our civilian hospitals to be prepared for a large event. If we don't start drilling it, we're not going to be able to perform when the time comes. So it's something else I think we need to put on our list to get done and start to improve capabilities so that we're ready to respond when needed.
And I think the blood product aspect of that training has often been neglected, if it's ever even been mentioned. It's a critical resource. I think we have to include that in future disaster drills, tabletop exercises, and include our blood bank in that planning.
Sweet. Well, Jeremy, thanks for contributing to the THOR Table of Knowledge podcast, and it's been good to talk to you. Thank you.
It's been an honor.
That's a wrap for this episode of the THOR Table of Knowledge podcast. A big thank you to our sponsor, Velico, for supporting the advancement of trauma care. Their frontline ODP spray-dried plasma system is paving the way for blood centers globally to produce potentially life-saving plasma for transfusions. Check out our website, www.thornetwork.com, for more podcasts, and join us next time as we continue to explore the cutting-edge science of trauma, hemostasis, and oxygenation. Until then, stay safe and stay informed.